Shachar Mizrahi suffered from severe post-traumatic stress disorder after fighting in the war against Hamas in Gaza 10 years ago. He could sleep only an hour and a half a night, tormented by nightmares and flashbacks, and rarely left his house or communicated with people. No therapeutic treatments helped until he heard about hyperbaric oxygen therapy.
I came here like a walking dead. And I feel like I don't have nothing in my life that can help me. So I put I did all in this therapy.
After 60 daily sessions of high-pressure oxygen treatments, Shachar's PTSD symptoms improved significantly, allowing him to sleep, study, develop a career, and even get engaged to be married. But the ongoing war in Gaza triggered his PTSD condition, so he has returned to the Hyperbaric Medicine Center for another cycle of treatments he intends to finish before his upcoming wedding.
Now where the war starts, so everything back for me like in a big, it came like so big, and it makes me scared.
The director of the Hyperbaric Medicine Center in Rishon Letzion, Dr. Shai Efrati, says MRI tests show that PTSD creates physiological changes in the brain.
We had the theory that it might be possible that actually severe emotional stress can cause damage to the brain, which is not less and sometimes even more than just mechanical injury. So it's easy for us to understand that stress can cause damage to the bone. For example, if you are running too much, if you put too much force on the leg, you may have stress fracture, we call it, okay, or stress injuries. So it happens to be that we can have it also in the brain.
He explains that the hyperbaric therapy works because of the fluctuation between 100% high-pressure oxygen the patients breathe through masks for 20 minutes and the normal air pressure they breathe when they remove the masks for 5 minutes. This extreme drop in the oxygen level is what triggers stem cells in the brain to proliferate and then repair damaged parts of the brain. The therapy is an established method for treating various kinds of injuries and infections. Efrati and his partner, Karen Donis Barak, were the first in the world to experiment with using hyperbaric oxygen therapy to treat PTSD a few years ago. And these days they are busy dealing with the many soldiers and civilians who have suffered extreme trauma from the Hamas attacks of October 7th and the 3 months of intensive fighting in Gaza.
Most of our business was treating post-traumatic veterans with combat-associated PTSD, but after the 7th of October, we also treat many civilians that got severely injured during the attacks. We have about 300 patients by now, and we expect to have up to 2,000 patients in 2 years.
The $10,000 cost of the center's treatments, which include a variety of therapies in addition to hyperbaric oxygen, is funded by the Israeli Ministry of Defense for veterans suffering from PTSD from Israel's wars going back as far as 1973.
And we've been treating hundreds of veterans. Many of them were injured in Yom Kippur War. And that's amazing to see that they get so much better after 50 years of PTSD.
These Israeli doctors hope their innovative research in PTSD treatment will help veterans of both the past and the future. Their center is partnered with a Florida hospital treating U.S. veterans as well. Linda Gradstein, VOA News, Rishon Letzion, Israel.